You're 40 years old in 1936, fat, sweaty, with breath that could drop a horse at 20 paces. Your medical practice in Berlin caters to the rich and famous, actors, aristocrats, people who can afford experimental treatments that might be complete bullshit. You've got a specialty in skin diseases and VD, which is polite code for I cure the problems rich people get from fucking around. Your wife's money bought you the fancy office on Kurfürstendamm. Your slightly dark features got you accused of being Jewish until you joined the Nazi Party in 1933 to make the problem go away. You're not political, you're practical, and right now, you're very, very good at making problems disappear. Your photographer friend Heinrich Hoffmann, who you recently cured of gonorrhea, introduces you to his buddy, Christmas Eve, 1936. A villa in the Bavarian Alps. The buddy turns out to be Adolf Hitler. He's got stomach cramps so bad they double him over. He thinks he's dying. Every other doctor has failed him. You examine him for maybe 10 minutes and diagnose complete exhaustion of the intestinal system, which sounds impressive and means basically nothing. You prescribe Mutaflor. It's bacteria cultured from the shit of a WWI soldier who never got sick. You're telling the Führer of Germany to swallow capsules of someone else's intestinal flora. And it works. The cramps disappear. A skin rash he's had for years vanishes. Hitler looks at you like you're Jesus Christ with a medical degree. He makes you his personal physician. You are now the second most powerful doctor in the Third Reich, and you have absolutely no idea what you're doing. The thing is, when Hitler's a hypochondriac, terrified of death, obsessed with his health, convinced he's going to die young like his parents. He won't let anyone examine him properly. No x-rays, no comprehensive testing. Whenever something hurts, you show up at his bedroom with your little black bag and poke the area that hurts. That's it. That's the extent of your diagnostic process. You're treating the leader of Nazi Germany based on vibes. But Hitler trusts you. Everyone else in his inner circle thinks you're a charlatan. Hermann Göring calls you Reich Master of Injections behind your back. Albert Speer thinks you're a quack. Eva Braun won't even let you near her anymore because you have the manners of a pig. When you eat dinner at Hitler's table, people physically recoil. Your hygiene is apparently that bad. Hitler doesn't care. I do not employ him for his fragrance, he says, but to look after my health. You start slow. Vitamins, glucose injections, hormone extracts. Then Hitler complains he's groggy in the mornings. So you create something special. You call it Vitamultin. Little gold-foiled packets that you mix with water and inject directly into his bloodstream before he even gets out of bed. It works like magic. Within minutes, Hitler goes from barely conscious to alert, energetic, ready to invade Poland or whatever's on the schedule. The secret ingredient is methamphetamine. You don't mention that part. By 1941, you're injecting Hitler almost every day, multiple times per day. He needs to feel permanently refreshed, constantly euphoric. You're happy to oblige. Your medical diary fills with entries, drug after drug after drug. You document everything obsessively because you know what happens to doctors who kill dictators accidentally. The Gestapo gets curious. The war starts going badly in late 1941. Hitler's stressed, can't sleep, stomach problems returning. You add Pervitin to the cocktail. More methamphetamine, different brand. Then hormones extracted from the testicles and prostates of young bulls. You're injecting him with animal sex organs. He doesn't ask questions. You don't volunteer information. 1943. The Soviets are pushing back. Stalingrad is a disaster. Hitler needs to meet with Mussolini and he's dreading it. He's in pain. He's exhausted. He's falling apart. You need something stronger. You prescribe Eucodal. It's similar to heroin. Actually, it's stronger than heroin. When it's called oxycodone, and in 80 years people will get addicted to it in trailer parks across America. But right now, it's a nice German pharmaceutical product from Merck. You give Hitler his first injection before the meeting with Mussolini. His mood transforms instantly. He's euphoric, energized, talking a mile a minute. On the way to the airport, he demands a second shot. Everyone's thrilled the Führer is back in form. You're thrilled because now he needs you even more. You add cocaine for his sinuses, barbiturates for sleep, morphine for pain, testosterone, estrogen for some reason. You're not even sure why anymore. Strychnine and atropine in his anti-gas pills. You're giving him 20 injections some days. The veins in his arms look like road maps. His legs too. You run out of good injection sites. Your medical bag is a pharmacological greatest hits album. 92 different medications, 20 of them manufactured by companies you own or have financial interest in. You're getting rich off this. Obscenely rich. You make 5 times the professor's salary just from Hitler. Plus, you've got pharmaceutical companies, a factory making vitamin supplements for the military, another one producing delousing powder. You're pulling in millions of Reichsmarks. Some of the drugs you're injecting into Hitler haven't been properly tested yet. You're using the Führer of Nazi Germany as a clinical trial. He's patient A in your records. He doesn't know this. He thinks you're a genius. He tells people you saved his life. By 1944, Hitler's body is breaking down. Tremors in his left arm and leg. He drags his left foot when he walks. Severe headaches. Tinnitus. His vision's blurry. Stomach problems worse than ever. In September, he develops jaundice. Another doctor, an ENT specialist named Göring, gets suspicious of your anti-gas pills. He takes some himself and feels like shit. He has them analyzed. Strychnine and belladonna. The strychnine is causing the jaundice. He's been poisoning Hitler slowly. Göring reports this to 2 of Hitler's other doctors, Brandt and von Hasselbach. They've been waiting for ammunition against you for years. They bring it to Hitler. Tell him you're incompetent or possibly an Allied spy. Hitler fires all 3 of them. Keeps you. I have total faith in Dr. Morell, he says. You've won. Sort of. The problem is the Allies keep bombing Germany's pharmaceutical plants. In December 1944, the Merck factory in Darmstadt gets destroyed. No more Eucadol. And no more oxycodone. You try to find alternatives, but everything's in short supply. Hitler's been taking heavy opiates intravenously for over a year. Now he can't get them anymore. Withdrawal symptoms hit like a freight train. The tremors get worse. He's shuffling like an old man at 55. His face is pale and gray. His hands shake so badly he can't hold documents. You've seen the footage the propaganda ministry releases. Hitler greeting Hitler Youth in the final months. His whole body's shaking. He looks like he's aged 30 years. You can't fix this. You're out of drugs. You're out of ideas. You're out of time. April 20th, 1945. The bunker in Berlin. The Red Army is blocks away. You want to give Hitler another injection. He grabs your arm. You have been giving me opiates the whole time, he screams. Get out of the bunker and leave me alone. It's the first time he's figured it out. After 9 years, 800 injections, over 1,000 doses of medication. He's finally realized what you've been doing to him. You're ordered to leave Berlin by aircraft. You write in your diary, Hitler was very depressed. He must have had an important meeting the evening before. I wanted to give him another injection, but he grabbed my arm and lost his temper. You fly out on April 23rd, 10 days before Hitler kills himself. You land in Bavaria and immediately check into a hospital because you're also falling apart. Heart problems? Obesity? Stress. A week later, the Americans capture the area. They find you crying in a hospital bed. A broken man in a broken country. They interrogate you for months, move you from prison to prison. Yet they listen to your conversations. They want to know what you did to Hitler, what drugs, what doses, whether you were trying to kill him or keep him alive. You show them your meticulous records, your medical diary, every injection documented. You were just trying to help, you tell them. He was in pain. He needed treatment. You were a doctor doing your job. They don't buy it, but they can't prove anything criminal either. You weren't political. You just wanted money. And you got it. They release you in 1946. You walk out wearing an old American Army coat several sizes too small, borrowed socks, a shirt that doesn't fit. They drop you at Munich railway station. 2 hours later, Red Cross volunteers find you collapsed on a stretcher, hair wild, face pale, mumbling to yourself. The medical notes say serious heart problems, unable to work. A brain damage causing speech impairment. You end up in a clinic in Tegernsee. You never leave. Your former assistant will later say you died like a stray dog. May 26, 1948. Stroke. You're 61 years old, grossly obese, unable to speak properly. The man who once injected the Führer 20 times a day dies alone in a Bavarian hospital. Your wife inherits nothing. The Americans seized everything. The companies, the factories, the millions you made. All gone. The historians will argue for decades about whether you made Hitler worse, whether the drugs affected his decision-making, whether you're partially responsible for the Holocaust, the war, everything. The academic consensus lands on probably not. Hitler's racist ideology was fully formed by 1933, years before you met him. The drugs came later. They propped up a dying man and helped him maintain the illusion of strength and control as everything collapsed. But they didn't create the monster. You were just the dealer, and he was always going to burn out. You lie in that hospital bed in 1948, unable to form words, your body destroyed by the same excess you prescribed to others. The irony is not lost on anyone. You spent a decade injecting experimental cocktails into other people. Pig hormones, bull testosterone, rat poison, bacteria from human feces, enough amphetamines to keep a racing horse going for weeks, and in the end, you couldn't even keep yourself alive.